Bonsoir mesdames et messieurs, bienvenue à Procure en parle. Ici Winston McQuaid, porte-parole de Procure.
Hello, I am Winston McQuaid. Welcome. I will be your facilitator for our Prostate Cancer Awareness Month, the month of September. This is the opportunity to think, listen, and support men and families affected by prostate cancer. Since information is our first line of defense, I'm very glad over the next couple of weeks to host 4 webinars, one each week. The first one being tonight. We also will have some videos, original videos for you, as well as a series of podcasts called No Available. For those joining us for the first time, Procure is an entity in and of itself, say like the Canadian Cancer Society, but we're entirely dedicated to prostate cancer. Today, we will talk about screening with Dr. Nancy Girard, urologist in Chicoutimi. We will have a presentation from our specialist and some questions. About questions, we thank those who did provide their questions ahead of time. Otherwise, you may submit your questions live by using the Q&A feature on Zoom. So before we start, we want to thank our donors and especially the official presenter, Industrial Alliance, as well as Estelas and the Canadian and Quebec Urologist Associations. Thank you so much, Dr. Girard, for accepting the invitation. Without further ado, please go ahead.
Bonjour tout le monde. Ça me fait plaisir d'être avec vous ce soir pour présenter.
Hello, everyone. Good evening.
Oui, ça me fait plaisir ce soir d'être avec vous pour
Very glad to be with you. Let me share my screen in just one moment.
Comme ça ici. Je remercie Procure de m'avoir invité.
Okay, so I do thank Procure for inviting me for this chat tonight. Let's start with a bit of an overview of what we're going to talk about. We're going to talk about diseases that can affect the prostate. Then what are the risk factors related to prostate cancer? How can we prevent prostate cancer? We're going to talk about screening and then move on to our Q&A period. So let's start with an overview. We know that the prostate is a sexual gland. I don't know if you can see the arrow or the pointer on the screen. So the prostate is located inside the pelvis, between the bladder and the urethra. So right behind, we see the prostate in red. It's located around the urethra. It is rubbery to the touch. How do we know? Well, we can actually touch it through the rectum. It is typically the size of a ping pong ball, and the size can actually grow a bit larger for men over 40. So it's about 4 centimeters in diameter, so the size of a ping pong ball. When men get older, it can grow somewhat. It could reach the size of a clementine, sometimes even more significant sizing. It could be the size of a tennis ball. This is a rare occurrence, however.
Donc, dans la prostate, on a plusieurs zones qui ont des rôles un petit
We
peu
have several zones
différents.
around the
On va voir des
prostate. They
atteintes
each have their own
sensibles sur la
roles
zone.
and their own
Donc, on parle de la
vulnerabilities.
zone périphérique. C'est toute la zone qui est
We have the
au
peripheral zone first.
contour extérieur, si on veut, à
This
l'intérieur.
is the outside, so to
C'est la
speak,
zone
of
qui est
the
la plus
prostate.
proche du rectum.
This
C'est
is
la
the
zone
zone
qu'on
that's
va
closest
vraiment
to
palper
the
avec
rectum.
l'appareil
This is
périphérique.
what we can touch when we carry out a digital rectal exam.
Une bonne la majorité des cancers qui vont être
Most
dans cette
cancers
zone
are located in this zone, the peripheral zone.
justement assez pratique que ce soit dans cette zone où on
So
retrouve le plus de
thankfully,
cancers. C'est dans cette zone-là qu'on va pouvoir
this is
faire
where
l'appareil.
we can
Ensuite, on a la zone de
feel them to
transition,
the
la zone
touch.
transitionnelle qu'on appelle. Ça, c'est vraiment
We
la
have
zone
the
qui est
transition
au
zone. So
contour
this
de
is
l'urètre.
the zone around the urethra.
Naturellement avec l'âge.
This
On
is
va
the
dire que ça
zone
devient
that
plus
enlarges
de la
with
prostate avec
age.
son grossissement. C'est elle qui va causer les problèmes urinaires là, au niveau de l'urètre.
This is the zone that can
Elle peut avoir
be involved in difficulty urinating, for instance.
sauf que c'est pas la majorité, on parle environ de 10% des cancers.
It represents about 10%
Ensuite,
of
la zone
cancers.
centrale,
Then we have
cette zone-là,
the
encore
center.
moins de cancers là, qui se présentent
Even
dans cette
less
zone. On parle
cancers are
de
located there, very
ça,
few,
c'est
about
autour des canaux
5%.
éjaculatoires.
So
C'est une
this zone
zone
surrounds
qui
the
va
ejaculatory
aider
ducts.
l'éjaculation. C'est une zone qui n'est pas vraiment palpable.
This
Puis,
zone
pas
cannot
toucher
be
rectal, mais
felt
on
with
peut
a
toucher
digital
avec
rectal
ce
exam, and
tissu de l'urètre. Donc, il va falloir
we cannot really
d'autres
get any
à d'autres
tissue from there
zones
either. So we need to
avoir une suspicion de
use
cancer, un cancer qui se développe dans cette
other means in order to detect cancers in this
Quel
zone.
rôle est là dans la vie, la prostate? On pense souvent que
What's
c'est
the
la
role
dernière
of
chose
the
qu'on
prostate? We
entend
tend to
vraiment
think that
parler, à part
it's not
quand
really
on parle pour
useful
le
because we don't
cancer.
hear about it
Et
apart
ça
from
produit
cancer.
le liquide éjaculé.
Well,
80% du liquide va
it has a
provenir
role in
de la
producing
prostate,
the
entre autres, des
ejaculate.
vaisseaux
80% of it
associés à la prostate.
comes from
Ce
the
liquide
seminal
va
vesicles that are
servir à
attached to the
nourrir et
prostate.
protéger les spermatozoïdes pour qu'ils soient
The
en bonne
liquid
santé pour performer
exists to
bien.
nourish and protect the spermatozoa so that they can perform adequately.
Protéine qu'on appelle l'APS.
The prostate also produces the PSA. It's a type of a protein. This is what actually we look at with blood work. PSA is the prostate-specific antigen. It also helps sperm to remain in liquid form. The prostate also allows for ejaculation. It contracts in order to have the ejaculate leave the body. Sometimes people believe that it has a role in erection, but it does not. That is not the case. So anything prostate related do not play a role in any issues with erection. This is a completely different mechanism. So do not be fooled. The prostate is not at play in this case. So what diseases can be related to the prostate? There are three. There could be hyperplasia, so an enlargement of the prostate. This is typically harmless. It happens with about half men, 1 out of 2, from 50 years old on. So it's a natural phenomenon for the prostate to enlarge over time. About half of men, again, will have this condition, but about 25% of them will need to consider treatment. Another category, the inflammation of the prostate, which is called prostatitis. It means either an acute or chronic state of inflammation. It could be related to the presence of bacteria. If it's a chronic inflammation, then it could be caused by something else. About 1 man out of 2 could have an inflamed prostate. This is not related to age, however. Third, a disease, of course, prostate cancer. 1 out of 8 will have prostate cancer. These statistics do rise over time. Typically, in earlier stages, there won't be any symptoms. This is why we talk about screening so much. Now, what are the symptoms related to these conditions? Oh, I hope you can see well. So in the case of hyperplasia, there could be difficulty urinating. The flow of urine could be weak or otherwise. So people could need to urinate more frequently. There could be also a burning sensation along with urinating. There could be blood either in sperm or in the urine and some urinary leakages as well. Now on to inflammation. There can be some pain, some difficulty urinating, also some leakage. There could also be pain in the pelvis or the lower back. Ejaculation could also be painful, and there could be fever if there's bacteria involved. Now, onto prostate cancer. Like I just mentioned, typically early on, there are no symptoms. When the tumor grows, then we can sometimes feel some symptoms. Now onto treatment. So for benign hyperplasia or the enlargement of the prostate, treatment is simply for maintaining quality of life. So if we feel that we need, we can consider treatment, but it's only in the case of being inconvenienced. Typically, if there is no inconvenience, there is no need for treatment. However, if there is obstruction, then we can look at medication. If medication does not work well, or if the side effects are difficult to manage, or if symptoms persist, then we can look at surgery. The surgery is not the same in this case as cancer. So for hyperplasia, we use natural ducts and remove part of the prostate in the transition zone. I typically compare this this way. So if we have a donut, the urethra passes through the hole, and we're going to eat out the donut from the inside of that hole. Now, treatment for prostatitis. If the cause is bacteria, then there will be antibiotics. It could be over 10 days or over a few weeks, sometimes more, depending on the type of infection. If the cause is not related to bacteria, then we can use combination therapy. Then, onto cancer. There is a host of options. It will depend on age, the type of cancer, life expectancy of the patient, also comorbidities or other health issues. All of these will be taken into account. If the cancer is not significant, then we can do active monitoring. If the cancer is more aggressive, then we can have surgery, radiotherapy, or other types of therapy, such as brachytherapy. If it is a late stage cancer, then we could look at hormonal therapy or chemotherapy. Each cancer is different and each patient is different. And again, when we mention surgery for prostate cancer, we're not talking about the same surgery as would be the case for hyperplasia. For cancer, we remove the prostate altogether. So what are risk factors for developing prostate cancer? We know that 1 in 8 men will be diagnosed with prostate cancer and 1 in 29 will die from it. These are the most recent statistics. In 2022, 24,000 Canadian men will be diagnosed. About 10% of them will die from it. And on average, 67 Canadians receive a prostate cancer diagnosis, including 12 Quebecers. So risk factors. Being over 50, the risk grows as age does. Family history plays a role. Also, African American men are more affected by this cancer than others. So your risk is higher if you have one affected family member, father, brother, or son. Then your risk is 3 times higher. If you have 2 affected family members, then your risk is multiplied by 5. Your risk is higher also if a parent or a family member was diagnosed before the age of 50 or 60. And your risk is also higher if you have a history of cancer, such as breast, ovary, pancreas, lungs, or colorectal cancer. These are typically related to hormones, so we need to pay attention to our family history. There are genes at play, like we just mentioned, for breast, ovarian, pancreatic cancer. There is a mutation in the gene called BRCA1 and BRCA2. This mutation does increase the risk up to 4 or 8 times, depending on the study. There are other genes that are most likely at play. Studies are ongoing to identify these genes. We especially want to know what defective genes are related to more aggressive forms of cancer. So again, if you have known family history or known mutations, then you should mention that to your family physician or urologist if you already see one. The genetic related cancer represents few cases, however. So we talked about also the ethnicity. So Black men and men of Caribbean origin are more at risk. For these men, cancer tends to appear at a younger age and to be more aggressive. Fortunately, the cure rates are similar to other men, even if it is more aggressive and appears at a younger age. Now, risk factors related to diet. Many studies focused on this to see if the diet is involved and how much. The main ideas here is foods rich in red meat could have a negative impact. Foods rich in animal fat and dairy products as well. Processed foods and cold cuts could also be related to a higher risk. Junk food, sweets, etc., could also have an impact. However, studies have not demonstrated an effective diet strategy that would prevent prostate cancer. If we know that these foods have an impact, then we can just reduce our intake. Now, what about being overweight or obese? This is also a risk factor. We do see more cases of prostate cancer in people who are overweight. Why? Well, along with obesity, we have the PSA levels that are diluted out, so to speak. And we want to watch out for high levels of PSA. So if the levels are low, we could be misled into thinking that there is no problem. And then when we finally find out later on, the cancer has had time to develop. About vitamin D, the jury's still out. Some studies show a risk, others not. But the risk could be increased if you have a deficiency or a surplus of vitamin D. In Quebec, we talk about deficiency more so than a surplus because of our long winters. So it's quite frequent here for people to have a vitamin D deficiency. So who is at risk? Men who are over 50, who have darker skin, and who do not get much sun exposure. A few other factors where, again, the jury is still out. Having an enlarged prostate, hyperplasia, like we mentioned, is not related to a higher risk of cancer. Acute prostatitis is not related to higher risk of cancers as well. The frequency of sexual activity, also unrelated. Several studies have focused on that in finding out if the frequency of sexual relations affect the risk of cancer. According to a few studies, actually, having sex is a protective factor. Having had a vasectomy is also unrelated to developing prostate cancer. We could think also of testosterone replacement therapy. The idea here is that testosterone does not increase the risk of developing prostate cancer, but it could fuel it if it is already present. So if we are cancer-free, there is no higher risk. But if we do have cancer, it could be fueled by testosterone. Hormonal therapy can be used to block out testosterone and its action, which helps in stopping prostate cancer. A few myths now. We hear various things, right? So no, you cannot get cancer through semen, or neither by blood nor urine. You don't urinate your cancer. That is a myth. Sometimes also people believe that semen can be radioactive when the patient undergoes radiotherapy. That is not true. And the person also is not radioactive.
D'autres choses, ben, on sait, il y en a qui pensent que peut-être qu'ils ont un cancer, ça va
Some people
augmenter leur
believe
santé, alors que
that
ben, non
the
plus,
cancer
sont là pour
will cure
disparaître.
itself more
Puis,
or less,
donc,
but that
c'est
is not the
important de
case. It does not
prévenir avec
resorb on its own.
naturels
Also,
quelconques
prostate
pour
cancer
avoir
cannot be
prévenir.
cured with natural
Plus
products.
naturel, là, il n'y a pas grand-chose il n'y a pas vraiment de produits naturels qui ont été prouvés pour une guérison.
So, unfortunately, no natural products have been linked to
Donc, maintenant
curing
qu'on sait tous
cancer.
ces facteurs de risque-là, comment on fait
So
pour essayer
now
de le prévenir? Qu'est-ce qu'on peut
we've
faire
covered risk factors.
pour être moins
How can we
exposé?
prevent
Quand on parle de
prostate cancer?
cancer en général, les
When we
études
talk about cancer
épidémiologiques ont montré
generally,
que 40% des cancers
studies show
sont
that
liés au
40% of
comportement
cancers are linked
initial,
to our
que 40%
behaviors.
des cancers peuvent être
40% of cancers
prévenus
can be
par
prevented
l'activité physique et que
by
30%
regular
ne
physical
peuvent
exercise
pas être
and 30% through
être
healthy
prévenus également par une nutrition.
nutrition.
Fait que même si des fois, c'est pas
So
spécifique
even
au
though
cancer de la
sometimes it's
prostate,
not
on va essayer de
specific
jouer sur
to
ces facteurs-là
prostate
pour
cancer,
diminuer notre
we
risque
do
de
try to take these elements into account in order to
numéro 1,
prevent
faire de l'activité physique.
cancer,
On
including
en parle
prostate cancer.
souvent
So
quand on parle de santé, l'activité
physical
physique, on dit
activity,
tantôt
exercise,
les
we
volets de la
hear
santé.
about
Ben,
that
je pense que
a
c'est vrai pour le
lot.
cancer et pour le cancer de la prostate, c'est quand même important.
It
On
is
parle
very,
d'activité
very
physique, on
important.
parle pas de faire un Ironman ou un
You don't
marathon.
need to run a marathon here. This is not the idea. The idea is to get moving every day. Weight-bearing exercises are especially fantastic, especially for bone health. So if you want to have strong, healthy bones, especially from 50 or 60 years old, weight-bearing exercises, weightlifting is really beneficial. You don't need to be lifting huge weights. We can simply support our own weight. So walking will work. You can use the elliptical machine or the staircase simulator. All those are exercises where we bear our own weight, and that will work. If you're not sure where to start, if you're not used to exercising, start with walking. It doesn't need to be 1 hour, but simply integrate some walking into your life. You could exercise when you feel well, when you feel your best during the day. You could park farther away when you're running errands, for instance. So instead of parking right by the door, you could park further away. Use the stairs instead of the elevator. During commercial breaks, get up and move. We shouldn't, by the way, not sit for periods longer than 30 minutes at a time. We should move with moderate intensity, 30 minutes a day. It doesn't have to be in one sitting. It could be spread out over the day. So if you just take a walk, a 30-minute walk, that will do it. Also, move with someone else. It's always more motivating. Now going deeper into nutrition. Hopefully you've had dinner because otherwise you may get hungry. The main idea here is to eat healthy, eat fresh produce, more so than processed foods. Sometimes it is difficult to know what we can change with our diet. Sometimes we have specific habits. Sometimes a referral to a nutritionist can be very beneficial in this case. Otherwise, let's hit a few of the basics. So minimizing processed foods, cooking with fresh foods, avoiding prepared foods and processed foods again. We should reduce our intake of fat, salt, and sugar. We should watch out for the amount of meat also, max 3 servings per week. We should also limit our intake of deli meats, cold cuts, and processed meats, and watch out for liquid calories such as juice. So anything that is not water that we drink will have a high calorie level, and we need to watch out for that. Again, healthy eating. You can look at the Canadian guide, focus on 7 to 10 servings of fruit and vegetables per day. Eat fiber and whole grains, eat fish and vegetable protein or plant-based protein, low-fat dairy products, and good fats like olive oil. We need to mention calcium. The calcium intake, especially if we're at risk with our bone health when we reach a certain age, we should have a calcium intake of 800 to 1200 milligrams per day, so 3 servings of milk. Vitamin D intake, also again important in countries with long winters, so you could always add that and take vitamin D as a supplement. Other protective factors. Vitamin E is good for you. You can find it in vegetable oils or plant-based oils, green vegetables as well. And selenium also could be beneficial for the prostate. It's found in nuts. Omega-3s are good, and zinc is good as well. Changing your eating habits also has benefits, not just for cancer, but also for your heart health. Again, good eating habits and exercise habits have an impact not only on prostate cancer, but all types of cancer. So we move, maintain a healthy weight, and we eat well. These are the key behaviors for preventing cancer. Let's now talk about screening. We've covered what could cause cancer, what could help us prevent it. Now we're going to focus on how do we screen cancer? How do we identify it? We already did mention that prostate cancer in its early stages is asymptomatic. So how do we go about it? We have a strategy, which is screening. This helps us to identify people who may have cancer unknowingly. Again, prostate cancer is often asymptomatic in its early stages. And this is where we want to intervene because the disease is still curable. This is why we focus our efforts on screening. So we try to identify cancers early on so that treatment is effective. There could be a few symptoms, for instance, blood in urine. Do see your doctor right away. If you have urinary symptoms, if you have difficulty emptying your bladder, or renal failure, these could be linked to prostate cancer. Bone pain could also be related to a cancer that has metastasized already. When prostate cancer spreads, it typically spreads to the bone. So the goal of screening here is to detect clinically significant cancer in its early stages in order to cure it. What are the means for screening? Main one is PSA, elevated PSA. Again, PSA stands for prostate-specific antigen. PSA is produced by the prostate. So it is specific to prostate, but not to prostate cancer. There are other conditions that could lead to elevated levels of PSA, not necessarily cancer. Most cancers do lead to elevated levels of PSA, but there could be other causes. For instance, cystitis, prostatitis, urinary retention, inflammation around the prostate. This could also cause elevated PSA levels. If you had some type of medical intervention or manipulations around the bladder or the prostate, that could also lead to a rise in PSA levels. Ejaculating can, for a short time, of course, lead to a rise in PSA levels. Cycling for a long period of time could also lead to a rise in PSA levels and a rectal exam as well. Hyperplasia, also an enlarged prostate, typically leads to higher levels of PSA. And again, prostate cancer, of course, is related to high levels of PSA. Well, how do we carry out good screening? We talked about PSA, but how do we carry out PSA screening? How do we put this all together? So the Canadian Urologist Association suggests to offer PSA measurement to specific patients. So in men whose life expectancy exceeds 10 years. So you need to be expected to live more than 10 years for screening to be worthwhile. It should be based, of course, on shared decision-making between the healthcare professional and the patient. The patient should be aware that screening is carried out, and the patient needs to want to know whether they are at risk of having prostate cancer. When do we start this screening? Typically, we start somewhere between 50 and 70 years of age. If there is a family history or if there is an African-American descent, then we can start earlier on from 45 years old. We mentioned the defective genes such as BRCA1 and 2. So this needs to be assessed with a genetic counselor. So how do we go about measuring PSA levels? It's simply with blood work. We also need to carry out a digital rectal exam. We want to check if the texture is smooth or are there nodules? Is the prostate symmetrical or not? These are factors that we need to check. What are the benefits of screening? Of course, one can feel reassured that there is no cancer, and we prevent metastases and death from prostate cancer since we can have an early diagnosis. These are the benefits. Now, disadvantages. The patient could worry about high PSA. It brings some stress if our results are slightly out of range or slightly elevated. There could also be a negative impact from having a prostate biopsy. Sometimes there is overdiagnosis, meaning we identify a cancer, but this cancer is not clinically significant. We could have simply ignored it and not treated it, and there would have been no consequence. So these are the disadvantages. This is why we need to have a conversation between the doctor and the patient. We have a decision chart here, again, based on values with the Canadian Urologist Association. We typically carry out a screening every 4 years or 2 years, or more frequently every year, depending on the PSA level. It also depends on age and other factors. So if PSA is over 3, then we can carry out additional testing. We can look at the density of PSA, its velocity. We can use an MRI. And this helps also with the diagnosis, and we could use also a nomogram to get some perspective on the decision making. Afterwards, if we wish to do so, then we can carry out a biopsy. For most men, we will stop screening around age 70, or if life expectancy is lower than 10 years. In Canada, life expectancy is about 82 years for men. So starting at age 70, we can start, we can actually stop screening. Also, if PSA levels have been low and remain low, again, we then reduce the frequency of screening. So we mentioned the investigations. Elevated PSA levels or an abnormal digital rectal exam will lead to potentially a prostate biopsy. A biopsy is the only way to diagnose prostate cancer. We mean we need to collect cells and test them in a lab. A prostate biopsy is not a procedure that's fun, but it's really not that bad. Typically, we collect about 12 samples through the rectum. So you shouldn't be scared of this procedure. It's quite well tolerated. And again, it is the only way to get a cancer diagnosis for your prostate. More and more, we also use MRI, so magnetic resonance imaging. This helps us to see if there are any suspect lesions. It allows us to look at various zones. An MRI is helpful again, but cannot lead to a diagnosis. For a diagnosis, we need actual tissue. Typically, when cancer develops, there are a few different nodules not a single mass, and this is why we sample various spots on the prostate. So hopefully this was helpful to you to talk about screening, some risk factors, and some prevention. Again, screening does save lives because we can detect cancer early on before symptoms appear. So I think if you're in the right category of patients for screening, then it really makes sense to use screening. As mentioned, we can also use MRI to help diagnose prostate cancer. Treatments also improve quite a bit in recent years. There is a lot of interest and a lot of options, especially for later stage cancers. Everything, of course, depends on research and studies in order to develop treatment, find new markers, find new ways to go about cancer. So we do need to thank researchers for all their efforts. Thank you so much for your attention. Thank you, Dr. Girard. This was a remarkable presentation. Now, on to questions. I am a truck driver. I've had issues with my prostate, so infections, prostatitis. I've even stayed in the hospital for prostatitis. Could this lead to cancer? Yes, like I said earlier, prostatitis is not linked to developing prostate cancer. However, if you have chronic inflammation in any organ, in fact, that could lead to developing abnormal cells that could lead to cancer. So we do need to draw the line here. If you have chronic inflammation or chronic infection, that could, yes, be related, but prostatitis in itself is not related to developing prostate cancer. Another question. I've read that a vitamin D deficiency could be a risk factor. Is it true? And how can we know whether we are deficient in vitamin D? Yes, as I explained earlier, we are in a northern country, right? So yes, we are at risk of vitamin D deficiency due to limited sun exposure. So if there are any concerns, it's very easy to check. You do just carry out some blood work in order to know whether your vitamin D levels are okay or not. We do know that vitamin D plays a role in reducing inflammation. So a deficiency may have an impact on inflammation, which in turn could have an impact on developing cancer. Some recent studies have are looking at that currently. So checking is a good idea, and using supplements is a good idea for our health, generally speaking. Okay, next question. I'm 75 years old. I often urinate at night, and lately I had blood in my urine and semen. Could this be related to prostate cancer? Well, typically, prostate cancer is asymptomatic in its early stages. But yes, blood could be an indication of cancer. This does not mean necessarily if you have blood in urine that you do have cancer. At any rate, if you have blood in your urine, this is not normal. So you should always talk to a doctor and not wait, because it could also be a bladder cancer or something else. So we really need to check the complete urinary system. Could it be also other organs? Yes, kidneys, bladder, urethra, prostate, everything needs to be checked in this case if you have hematuria. We can use a camera to see what's going on inside. We could also use a digital rectal exam and some scans. So we really check the whole system. What if someone does not have a family physician? What should we do? Yes. If you have blood in your urine, then do see a doctor. You don't need to go to the emergency room necessarily. You could use a clinic, a walk-in clinic, but you don't want to be waiting for months on end. If you see blood once, you do need to be concerned. Sometimes patients see a doctor only 1 year later, and then we diagnose a late stage bladder cancer, for instance. So it doesn't need to be the same day that you see a doctor, but do not wait. And should we expect the physician at, say, the walk-in clinic, you know, should the attending physician refer us to a urologist? Your attending physician will look at your symptoms. If there is blood in your urine, then they will be referring you either in a matter of days or a few weeks to a urologist. Another question is simply signs and symptoms. When should we talk to a doctor? Well, if you have a family physician, if you have any urinary symptoms that are an inconvenience, this is not necessarily related to cancer, but if you have difficulty urinating, if you need to go frequently, for instance, then just mention it. It is never a waste, and we can discuss if the symptoms are concerning or not. If you're unable to urinate, then you do need to see a physician quickly. And again, if there is blood in your urine, you do need to see a physician quickly. What else? I think these are the main points here. If you have bone pain, sudden fatigue, these could be signs of a more advanced cancer. So also do talk to your doctor in this case. When we see a physician, will the physician carry out the digital rectal exam systematically? Well, now a lot of people focus on blood work, not urologists, but rather general practitioners. A rectal exam is part of the diagnosis, is part of a good prostate exam. If you are being monitored with a urologist, if your condition is stable, then we could skip the rectal exam, but it does need to be done occasionally. But it's a first visit, if we want um, to look at uh, prostate for any reason, I think the digital rectal exam is a must. Because sometimes men are quite hesitant to accept this procedure. Yes. If you see a urologist, you won't really have a choice. If you're if you're with your family physician and you say no, that's okay, I don't feel like it, your family physician probably does not really is not super eager to do it, so they'll probably prescribe blood work and keep it at that. So it's really up to you to know that we do use both a digital rectal exam and blood work. It really kind of depends if there's a nodule or something else. And normal levels of PSA. Sometimes this is the way that we detect cancer. If there's an abnormal nodule uh, or something else with the prostate, then typically it means the cancer is more aggressive. And in some cases, PSA levels don't rise right away. So I think, even though it's rare, it's worthwhile to look at the digital rectal exam. Okay, another question. I'm 72. My doctor said that screening is not worthwhile. However, I'm concerned because one of my friends is 77 and was diagnosed with an aggressive prostate cancer. So should I be concerned? Well, it really depends on your global health. If you have cardiovascular disease or diabetes, if you're 72, then the risk of dying from one of these causes is much greater than developing a prostate cancer that will lead to death. So it really depends on your general health. Always think about 10 years of life expectancy in order to know whether screening is worthwhile. So if you're 72, this is above the target range, which is around 50 to 70, especially when we know that life expectancy for men is about 80 years in Canada. If you're very healthy, though, at 72, and if you want to be reassured, then have that conversation with the physician and talk through the benefits and disadvantages. So, yeah. What about PSA levels? Can they vary from one lab to another? It can vary somewhat. When we talk about elevated PSA levels, we always look at a second blood work. So, because yes, it varies from one lab to another, but it also varies a little bit due to other factors from 1 month to another, say. Should the blood work always be done at the same time of the day? No, that is not a factor at play here. So we simply try to have about 4 to 8 weeks between the two, the blood work in order to confirm. Okay, last question. My PSA levels were at 5.8 initially. Now it is 4.6. I'm 60. Digital rectal exam is normal. Should I carry out or carry on with the biopsy? Well, I say yes, do have the biopsy. If PSA levels are not low or very low, you should not cancel your biopsy appointment. Okay. All right. So we're wrapping up. Thank you so much, Dr. Girard. Thank you Thank you for your work as a urologist in Chicoutimi. Any outstanding questions will be entertained and replied to via email over the next few days. Our next webinar will be September 30th at 7 p.m. We're going to talk about treatment options for a localized cancer with Thierry Lebeau. He's a surgeon and urologist at the CIUS of Montreal. All right, so on behalf of my cat here and everyone at Procure, thank you so much for your attention. Thank you again, Dr. Girard. See you next week.